All right, today we're going to jump into the world of treatments for a pretty rare genetic condition called hereditary angioedema, or HAE for short. We're going to break down all the different medications out there and, try to make sense of what can be a really confusing landscape.
So first things first, what exactly is HAE? Well, it's a genetic condition, and the main thing to know is that it causes these really severe and totally unpredictable episodes of swelling. This can be super painful, it can happen basically anywhere in the body, and in some cases it can even be life-threatening. So the treatments we're about to cover, they're all designed to get these sudden attacks under control.
Now, when it comes to managing HAE, it's not like there's one single magic bullet. The strategy is really a dual approach. I think a great way to think about it is like having two completely different toolkits for two very different jobs.
And here are those two toolkits side by side. On one hand, you've got on-demand treatment. This is your emergency response, the stuff you use to shut down an attack that's already happening. Then on the other hand, you have preventative treatment, which you might also hear called prophylaxis. This is the long game, the proactive plan designed to stop attacks from even getting started.
Okay, let's dive into that first toolkit. We're talking about acute attacks. When a patient is going through that swelling and pain, the clock is ticking. These are the medicines you reach for when you need to intervene, like right now. So here are the main players in the on-demand category. You've got Ruconest, Berinert, Kalbitor, and Firazyr. And you can see they all have the same job description, right? Their whole purpose is to treat an acute HAE attack as it's happening and get things under control fast.
But how do you actually take these emergency drugs? Well, it's not a one-size-fits-all situation. Some of them are given intravenously, meaning through an IV. Others might come as a series of 3 injections. And this is a big deal. Some options can be self-administered. That's a huge step because it empowers people to treat an attack the moment it starts without having to race to a hospital.
All right, so we've covered the emergency response. Now let's switch gears and talk about the long-term strategy. The goal here is totally different. It's not about stopping attacks, it's about making sure they never even show up. This is the proactive side of managing HAE.
And here's the lineup for the preventative meds, the prophylaxis treatments. You've got options like Orladeyo, Cinryze, Haegarda, Takhzyro, and a few others. Their purpose is super consistent across the board, to prevent angioedema. It's all about creating this constant baseline level of protection in the body.
And just like the on-demand stuff, how you take these varies, which is great because it lets people find what works for their lifestyle. You've got everything from a once-a-day pill to IV infusions, all the way to subcutaneous injections. That's just a little shot right under the skin that you might only need every 2 weeks or maybe even just once a month.
Of course, anytime we talk about medication, we have to talk about safety. It's an absolutely critical part of the conversation. And in the US, the FDA has really specific ways of flagging potential risks that are super important for everyone to understand.
One of the most serious signals you can see is something called a boxed warning. Kalbitor, for instance, has one. A boxed warning means that, according to the FDA, the drug may have serious safety risks. This is literally the strongest warning the FDA can issue, and it's a huge sign that a very careful conversation about the risks and benefits needs to happen.
So, here's the most important point of all. This is just for your information. It is absolutely essential, and I mean essential, that you talk to your doctor or your pharmacist. They're the experts. They're the only ones who can walk you through your specific situation, the side effects, and what treatment plan is truly right for you.
So if you walk away with one thing today, what should it be? It's that dual strategy, that two-pronged approach. Managing HAE effectively isn't about picking one or the other. It's about combining that safety net of on-demand treatments with the proactive shield of long-term prevention. And that kind of leads us to a final thought. I mean, the list of treatments for HAE has grown so much, offering way more options and hope than ever before. It really makes you wonder, doesn't it? With science moving so fast, what's the management of HAE even going to look like 10 years from now?